Varicose veins and spider veins are a fairly common problem these days. According to statistics, almost 80% of the global adult population suffers from these. And there are many techniques wherein one can resort to treat these unsightly, ugly-looking varicose and spider veins. Ones which are recommended are, of course, the laser treatments. But then there is also a very easy technique which is known as sclerotherapy. So if you look up the internet, you will come across sclerotherapy for varicose veins and spider veins. So what exactly is this sclerotherapy? Now, sclerotherapy is an OPD procedure wherein we use a solution which goes into the diseased vein. It damages the vein from inside and eventually helps it to collapse. The vein disappears basically. So the solution which is used is such that it is going to cause harm to the diseased vein and eventually make the vein disappear. Now the question arises as to what will happen to the blood circulation, because that is the commonest thing that my patients ask me. Well, the blood is only rerouted through the healthier veins. So this is a perfectly physiological treatment that one is doing, and fairly quick one as well. So as I mentioned, it's an OPD procedure, walk-in, walk-out procedure, maybe 15-30 minutes or so. One has to wear compression stockings for a few days, but that's about it. Now, CLACS is something which is, one can say, a replacement for sclerotherapy, but only for the small varicose veins, or what we refer to as the spider veins. Now, CLACS is an acronym for Cryo-LASER and Cryo-Sclerotherapy. Now, this is a Brazilian treatment which was started way back somewhere in 1999. We at Surekha Varicose Veins Clinic have been doing it since almost 2019 now. This is also an OPD procedure for the spider veins, wherein we use a jet of cold air on the area to be treated. After that, we apply laser, which is a transdermal laser, and following which we inject a solution. Again, it is a sclerotherapy solution, but very mild one. And the combination of laser and sclerotherapy will help to get rid of the spider veins. Now, where does one stand, or where do these procedures stand when in comparison to one another? Now, sclerotherapy is there in the recommended guidelines, of course, yes. But then for sclerotherapy, one has to be very careful when by using the solution, the concentration of the solution, the amount of the solution. And if that is not right, then the problem is the skin can become hyperpigmented. There can be ulcers on the skin, and that can be a big problem for the patients. This thing never happens with CLACS because the laser is controlled, because the sclerosant is weak, and therefore the results are fantastic. So compared to sclerotherapy, the results of CLACS are far more aesthetic. And another advantage with CLACS is that you need not wear compression stockings. So that's also very convenient. So to summarize, both techniques are equivalent, of course, in terms of results. But with sclerotherapy, one has to be very careful. For a safe, effective outcome for spider veins, CLACS is any day better.